handful. Okay. What to do if progesterone makes you depressed? That is a great question. And welcome in YouTube. Sorry for the technical difficulties. The question was, what do you do if progesterone makes you depressed? So it is a reaction, that is correct. And it's very small percentage of people who, instead of taking progesterone and going down the pathway to make allopregnanolone, which is an antidepressant, for some reason it goes from GABA to glutamate. And so in some of my patients, what has helped is the dose to be different, and also the dosage form. So sometimes it's immediate release, which is commercially available. You could get it at Walgreens, or if it is a slow release that you would have to get compounded. So those are all ways that people do better with progesterone. And depending on how old people are, if they're not on estrogen, you can give progesterone in different ways. Like you can give it in a topical form, which is a cream, and people don't usually have depression with that. Much less side effects, my handful. So that might be an option. But if you're on estrogen, we don't have any studies that show topical progesterone can counteract the effects of estrogen as far as breast and uterus. So welcome to all you guys joining in. I'm on my Tune In Tuesdays. I'm so sorry I couldn't help the person about her account. Ashley C just had a Dutch test done. I have high estrogen in my cortisol, and cortisone is almost flatline. Well, the effect of cortisol can affect your thyroid, can affect your androgens. I'm wondering, Ashley, is your DHEA okay? And wondering also how your estrogen metabolism was. But I'm glad you found that out. And think about something, Ashley, that can help you with stress. Gentle walking, meditation, yoga, a lot of times can help raise that cortisol, or adaptogenic herbs with rhodiola. Ashwagandha is another great herb. You can start with 300 twice a day, and hopefully they're checking out your progesterone too. Miranda, controlling abnormal cycles during perimenopause. I can't use combined OCP. Thoughts on norethindrone? Well, so I guess it depends on what are you controlling. Are you interested in controlling how heavy they are? For a lot of my patients, just taking Lysteta or tranexamic acid during the period can really help the heaviness. Are you interested in controlling the frequency? I am, or pain. Oh, spotting. Okay. So I don't use norethindrone. That is another type of progestin, because I'm not a fan of synthetic progestins unless they're for birth control. And since it sounds like what you're talking about is the spotting, mostly, Miranda, what we use in my practice is micronized progesterone. So that is a bioidentical progesterone, and we cycle it probably starting on day 10 and then continuing the progesterone every night until your next period starts. So that's an option. That does work for many people for spotting, but a lot of times we're doing a full evaluation with blood testing to start too, to make sure there isn't anything else. But great question. I posted a video just an hour or two ago. Hope you guys go back and check it out, about what is your worst symptom. So tell me, for those of you that are coming on here, you must have come on here for a reason. Is there a symptom that is the worst for you, whether you're in your 30s, in your 40s, in your 50s? Can progesterone cause joint pain as a symptom? Mary 77, that is a great, that is a really great question. It's not usually the progesterone that causes joint pain, it's the lack of estrogen. So you might be taking estrogen, and then maybe your estrogen was high, but now it's not. It's not actually the progesterone that generally causes joint pain, generally. But Mary, everybody's different. So I would want to know what your estrogen levels are, and I would also want to know what your DHEA and androgen levels are, because the lack of androgens can also cause you to have inflammation and joint aches. I see a lot of people with autoimmune issues with low DHEA having a lot of joint issues. So that's a great question. Let me know. So it sounds like joint pain was bad for you, Mary. Maybe. I'm wondering, any of you out there on YouTube, what are the symptoms that are the most bothersome for you? Because for me, the probably number one thing was sleep. Bridget, can I take HRT with progesterone all through my cycle, still having periods? So I think what you mean is, can you take estrogen and progesterone when you're having periods, or do you mean do you stop it during your period? So usually we have the protocol to stop it during your period, because We're just trying to mimic natural physiology. But for people that can't tolerate stopping it, we get creative because we usually personalize the dose. We address every patient individually and what's best for them. So, Bridget, if you find that when you're stopping your hormone therapy during your period, you feel awful, then I would talk to your provider, and there's probably a different way to do it. And thank you if you gave me the gift badge. Okay, the spicy cook. Is there a test for Hashimoto's? Yes. The test is thyroid peroxidase antibodies. That the presence of thyroid peroxidase antibodies means you have an autoimmune type of thyroid. It doesn't necessarily reflect what your TSH or your T3 or T4 are. Patty, sleep disturbances were a problem for me too. And PBC. So I'm thinking based on your symptoms, probably it's high estrogen, low progesterone. That's most likely what it is. Jamie, Montana. Where in Montana, Jamie? My memory word finding has been awful. So memory and word finding can be low estrogen or could be cortisol. True ticks. Tiden is 0.5, the dosage needed to protect heart and bones. So depending on where you read, if you're talking about a patch, that is definitely an adequate dose. Some of the studies are saying the 0.375 is adequate. And there was an article published in the Journal of Menopause that identified serum ranges that could confer bone density protection again. Okay, Jamie, Missoula, Western Montana. I spent a lot of time on Flathead Lake. So welcome to my live, and I love Montana. Kayla, I'm not ignoring you, but maybe your question was filtered out. So I haven't gotten a question from you, and probably maybe try to restructure your question by changing some words. I didn't realize that was even a thing until people said that I was skipping the question. And then someone else in the chat told me that your question is filtered out based on the word choice. So maybe think about a different word. Boheme by Vicky. When you say cortisol in memory, do you mean too much cortisol? Yes, Vicky. High cortisol, there have been studies that actually shrinks your hippocampus, which is your memory center in your brain. So yes, that is correct. How can I get my progesterone up? Sky, I don't know how old you are, but let me tell you, if you're younger, seed cycling could be helpful. And I know check on YouTube, my videos on seed cycling, because I think it's easier to find YouTube videos there than here. So the seed cycling is you take 2 seeds to support your estrogen and then 2 seeds to support your progesterone. The other thing you can try is Vitex. Chaseberry is another thing. Those are 2 natural ways to support your progesterone. Okay. Sky, you're 27. Yes. So look into seed cycling, and Funk It Wellness is one company that grinds the seeds up for you. So you have one bag for days 1 to 15 and another bag for 15 to 28. I think is another, but that's a little bit more expensive, but check into that. And I've also done some videos. Okay, Kayla, your question came through now. I got electric hair removal and I'm still growing. Labs are normal. So electric hair removal is a mechanical thing to affect the hair follicle, but not necessarily the hormones. So I'm wondering, first of all, I don't know like what they used and how the technique was and how that was. I would definitely check back with the provider that did the hair removal. But I'm also wondering what time in your cycle did you get the labs drawn? Kelsey, 5 months postpartum. Congratulations. I hope the baby is doing well. My DHEA and pregnancy levels are low, constantly bleeding related. Well, that's really interesting. I wonder what kind of stress you had before the baby, and also like how are you sleeping and what kind of rest are you getting now? And again, I don't know how old you are, Kelsey, but DHEA is the highest in your teens and 20s, and then it does decrease as you age. But the constant bleeding makes me think it's more related to estrogen and progesterone. Now, when you are nursing, your progesterone and estrogen are low. And sometimes people can respond by having breakthrough bleeding just from the low estrogen. But I don't know, again, if your cortisol, if they're low, it means there's probably some cortisol issue that can affect the way your thyroid works and the way your estrogen and progesterone work. So all of those things, I think you'd really benefit from getting everything checked. Stacey, how does your body stop menstruating if you're taking both estrogen and progesterone? So the only way you stop menstruating is when the brain sends a signal to the egg and there's no eggs left. The medication, The medication that you're taking, if you were taking a bioidentical estradiol, does not stop ovulation. But if you're taking a birth control pill or a synthetic hormone, yes, that can. So if you're taking a synthetic estrogen and synthetic progestin, that will stop you menstruating. But if you're taking a bioidentical estrogen and progesterone, if you're going to have your period, you're going to have your period. So I'm 56 and a half. I had a period this year. I had like 3 last year, and I've been taking estrogen and progesterone, I think, for at least 10 years. So it has not stopped my periods. My periods are still coming because I still have viable eggs, which I guess I should be happy about, right? Christina, my body always feels like it's dumping adrenaline, causes anxiety, blood work normal. So that, Christina, is very difficult to see in the blood. Um, you'd have to get certain things checked at 8 a.m., which I'm not sure when you had. I would see if you could do either something like the Dutch test, which is a dry urine test, or a salivary cortisol test. The reason why in this instance the Dutch test would be a little bit better is because on their test, they also have markers for neurotransmitters, dopamine, which can make you feel revved up, and also norepinephrine. That's part of their test. So if there's any way that you can take the Dutch test, that would be helpful. It is not covered insurance and it's kind of expensive too. Okay. Okay, Kelsey, you just told me you're 35. Not so hard. I don't have ovaries or reproductive system. I'm 32 years and still have not taken estrogen. Well, not so hard. I hope that you are okay. I don't know what the circumstances of your surgery, but I do know that the data is pretty clear. If you have your ovaries removed before the age of 45, now, this is not saying if you have breast cancer, so I don't know what the reason was, but let's just say you had it for bleeding. You have a higher risk of not taking estrogen than taking it, at least until the age of menopause. And that's from the American Menopause Society. Kayla said that, Kayla, going back to you, you said that treatments worked at the beginning. So then I would definitely want to look at your hormone levels. It may not just be your testosterone, it could be your estrogen and progesterone. Kayla Dockery, I'm on Nexplanon and my doc is recommending progesterone. Will that mix too much? Okay. Uh, Kudos to your doctor. So Nexplanon is not the same thing as progesterone. Nexplanon is a synthetic progestin and it's suppressing ovulation, but then it also competes. Think of having so many chairs. So Nexplanon is in a chair, and so progesterone can't get in the chair or the receptor to do its job. So by giving you progesterone, I actually think that might be a good idea. I know when I had a Mirena IUD, I also took progesterone, and I have done that with my patients also. Nacho Heart said, estrogen may cause blockages. I'm not really sure what you mean by Nacho Heart. If you take estrogen by a topical or an estrogen patch, it doesn't cause a clot. Okay, going to YouTube. Hi, Nicole. Thanks for joining. I came across a creator who credited her use of estradiol for helping her PCOS. She also claims that it feminized her future. Would you recommend? That's a really great question. And so there is some utility for PCOS patients, but I just think there's a lot of evaluation that has to go on there. You have to have estrogen evaluated not only on the day 3 of your cycle, but also potentially on day 21. And if you're not cycling, that might be something too. So I think there could be some improvement of your symptoms, Nicole, but you'd have to also use progesterone. Okay, beach and sunshine. I'm not sure why you're giving me the crying emoji. Okay, sorry. Gosh, it skipped. Okay, let me go back. It looks like I skipped a few things. So I don't want to miss some. Okay, Kayla. Okay. C. Barton. What could cause extremely heavy flow cramps, and would fibroid fit into a common side effects? Yes, fibroids and high estrogen are usually responsible for that. Boheme by Vicky, is there any blood test for a cortisol level? So there are traditional blood testing for cortisol. You have to get it drawn at 8 a.m. or 4 p.m. Those are the 2 times that we have normal labs for cortisol. And there's a wide normal range, but we can still get some utility for it. Does estrogen cause blockage? Natural heart, do you mean blockage in your intestine, in your arteries? Not sure what you mean by that. Oh, Kayla, your hair keeps falling out. So it definitely sounds like there's something going on, Kayla, with your hormones. So I'm wondering what's going on with your periods as well. Beach and sunshine, my body doesn't produce estrogen. Wondering if you are a younger patient. My body doesn't make enough estrogen. What can I do? Okay, so ways to promote estrogen seed cycling. If you're a young patient, they may also, but I'd want to know why. Is it the brain that's not sending the signal? Is it the egg that's not responding? We would do a workup to see why and try to treat the cause. Sarah, welcome. You have PCOS. I just did a webinar today from a lab, ZRT lab, which does saliva, blood testing, urine, about infertility, and we talked a lot about PCOS. Patty Pan Jones, sluggish, weak, tired on HRT, helping with other symptoms. Can low dose thyroid help? Free T4 is 2.4. That's actually a high thyroid T4 level. My lab is 0.8 to 1.8. So I'm not sure what assay they're using as far as your T4, what the normal range is. Do you mean T3? Because T3 is 2.2 to 4.2. Maybe you mean T3, Patty Pan. Also wondering if maybe you just don't have the right dose of estrogen yet, because low estrogen can make you tired. Bridget, do you worry progesterone will get too high on HRTs? That's a great question, Bridget. And I will tell you, as I mentioned, I have been doing this for 20 plus years. And progesterone, if you're taking it orally, it has a very short half-life, so it's in and out. So it's not very common. Sometimes I do have some patients with higher levels, but it's such a quick half-life that it normally is not a significant thing. It looks like I skipped something. Let me go back. Kayla saying you got Loletta. Okay, so Loletta, so Hashimoto's also can cause issues. And I'm thinking the Loletta is masking things, because with Loletta, maybe you're not having a period, Kayla, and you're having some issues with your hormones that you don't really realize because you're not having a period, because that's common on the IUD. Not sure. Okay, Patty Pan Jones, you went back. I have to go back and see what your question is. Okay. Oh, can low dose testosterone? Sorry. Thank you. Okay. Let me get back to your question now. Where did I see the answer? I'll come back to it. JBK, HRT, progesterone, 3 months, just increased dose and had light bleeding for the first time cramps. That's okay. That's not unusual. Okay, beach and sunshine. It's okay. My body doesn't make enough estrogen and my hair falls out and I have hyperthyroidism. So yes, it could be a pituitary issue. Kayla says, my endocrinologist says nothing is wrong. Well, something is wrong because it sounds like you have symptoms. So maybe think about getting a second opinion to somebody who knows more about female hormones. Beach and sunshine, you have irregular periods. So when are you seeing that your estrogen is low, beach and sunshine? Okay, looking back, where was your question? Your question was, okay, what to do. So when is it that you got your estrogen checked and when is it that you're seeing it's low? Beach and sunshine, and also not sure how old you are, so not sure if it's an aging thing or not. Okay, let's see. Bohem, what is PCOS? PCOS is polycystic ovarian syndrome, and usually it is irregular periods and high testosterone. Al, taking 200 of progesterone and starting to have bad headaches. Is that the only thing you're taking, Al? Okay, so now Patty Pan Jones said low testosterone. Free T4 is 2.4. So free T4 of a 2.4 is a little on the low side, but I really want to know what your rest of your hormone levels are to be able to see if, Patty, if testosterone is going to help you. But yes, those are some of the symptoms that testosterone could help. But testosterone is indicated for low libido and perimenopause, just saying that's when doctors prescribe it, not saying that it couldn't help you with sluggish, weak, and tired. I do think that's something it could help. Okay. Kayla Dockery, what does progesterone really help with? I'm just confused with it. Okay, so there's a difference, first of all, that you have to realize between synthetic, which is all the progestins and birth control, and natural, which is not birth control, is hormone replacement therapy. And progesterone usually helps you have lighter, shorter bleeding, helps you sleep, helps your moods, and it can be really good for your bones as well. Okay, Kayla, you know your body. If you think that something is wrong, think about maybe getting a second opinion because it seems like you're not really being heard. And that's one of the things that I'm trying to advocate for is that you guys know your bodies. And if there's something not right, even if your labs are quote normal, don't give up and keep looking for the answers. Okay, Patty, I see your question now that you're saying it's testosterone. Thank you for correcting me. Okay, let's see. Um, is a TSH level of 4 and T4 is 1.48 high for a woman? I'm tired and more anxious than ever. So those are both in the normal limits. The TSH is a little on the higher end, which usually correlates with an underactive thyroid, but your T4 is 1.48, which is also at the higher end. And in some labs, that might be high. So I'm really interested, Elle, what is your T3? Your free T3. That is definitely something that could be causing it. Um, okay, L, progesterone and headaches. So you can have headaches from not enough progesterone, and some of my patients have headaches from too much progesterone. It's like Goldilocks. It's on either side. It can be very confusing. Bohemian by Vicky here, thinking a lot lady. I'm 54 on a patch and a pill. So it sounds like you're on estradiol and progesterone. Have you had your androgens checked? Your DHEA, your DHES, and your testosterone free and total, and your dihydrotestosterone. Bridget, 47, zero libido. Will estrogen help with that? Yes, that's one of the things estrogen does help with. Also testosterone and progesterone. Okay. Fourth grade in 2024 is 11 low for estrogen, 48 years old and so tired. So for fourth grade in 2024, when? When in your cycle did you have an estrogen 11 or are you not having period? But yes, in general, no matter when that was taken, it's pretty much a low estrogen. It's starting to rain here, so I don't know if my Wi-Fi is going to go out here. Okay, let's see. Black Widow 86816. Is there anything other than PT for frozen hip on HRT, good diet and lifestyle? Arnica is something, arnica are those homeopathic pellets that can be really great for inflammation. Also, there was a study that looked at both turmeric or curcumin and frankincense, which is boswellia. And a lot of times that was as good as Advil. So maybe think into looking one of those. Any advice for someone coming off birth control pills after being on it for years? Well, there's a great book by my friend, Dr. Jolene Brighton, called Beyond the Pill. And so one of the things you want to remember, oh gosh, I don't know who gave me those balloons, but thank you. There's one of the things you want to remember is the birth control pill, taking it for years decreases your B vitamins. So maybe getting on a B complex could really be helpful. Going into something like seed cycling could be helpful too. And it could take a while for your periods to normalize. Margaret Bear could be Envoy CMV. Don't know what you mean by that. Oh, Kayla. Oh, you spent too much time and money. I'm so sorry. And that's the frustrating thing about you think you're going to an endocrinologist, you give them your concerns. Where I practice, I have not found that endocrinologists know much about female hormones. They are great with diabetes, hyperthyroidism, adrenal issues, a lot of things, but I just haven't found that they really address female hormones much. And it sounds, Kayla, that that's what your issue is. Kayla, my doc wants to start progesterone 100 milligrams. Is that a good start? That is actually the starting dose. It only comes in 100 and 200. So I'm just so excited when someone's doctor is thinking about that. So yes, fourth grade, I had an ablation, so I haven't had periods in 20 years. So you don't know. Yes. So with your estradiol of 11, I want to know what your FSH and LH are too, and your progesterone. But yes, it may be time for you to take some hormone therapy. Kayla, so if you've had a history of a lot of hair growth, maybe you have polycystic ovarian syndrome. So, fourth grade, tried patch and progesterone made me so sick. So, what I've seen fourth grade in 2024 is that some providers are starting people not on the lowest dose. So, I don't know what the dose was, but some people have come into me and they've been started on 0.5, which is there might be a protocol out there that's starting dose, but that's not the lowest dose at all. There's 2 notches down. So that might have been why you got sick. I have a lot of people that need to start really low and slow, especially if your estrogen is so low. Eighth grade teacher in Georgia, wishing you a great Tuesday evening. Thank you, Locker Skin, and thank you for following me. I love that. And thank you for what you do. Eighth grade is a really rough age, especially for girls. So love that you are doing that. Oh, Kayla, is my Wi-Fi switching out? It's because it's starting to storm outside. What are your current thoughts on spironolactone? Currently on 150 milligrams for hormonal acne. Apple user. Well, I have a lot of patients that have irregular periods because of the spironolactone. I do think it can work if you have high testosterone, but if your acne is from something other than high testosterone, it's not going to help. Now, what could it be? High estrogen. It could be food sensitivities. It could be gut bacteria. So I had patients come to me on spironolactone and they have other side effects, and it's not, their acne is not from that. Okay, Kayla, I think I answered your question about progesterone, about sleep, anxiety, breast tenderness, bleeding. Okay, spironolactone doesn't work for you. Yeah, so I wonder what the root cause of your issues are. Looks like my Wi-Fi, it looks like I'm a little frozen. Okay, Nicole, cycles are very irregular. We'll check with my doctor. Okay, so wondering, Nicole O, if you are seeing a gynecologist or a reproductive gynecologist. Hi, Huida, Hanuj, hi for bioidentical hormones. Do you prefer estradiol? That's a great question, Huida, over on YouTube. So when people are starting to go through perimenopause, usually I prefer estradiol alone because you can give them a patch and take it away because they can be high and low and high and low. But when they're done, so I'm taking an estradiol patch, and I probably am going to switch to the bias, which is the estradiol and the estriol. Lot less side effects, however, maybe not covered by your insurance and maybe harder to monitor. So it depends on where you are, where you live, and what's available. There's some countries that the patch is not available and then the biased is. Okay. Golden Con, if I share my hormone labs with you, can you tell me why I've been losing so much hair since last October? I don't think I can really because, first of all, there's always so many more questions. Like how's this, how's this, how's this? And then it becomes a consult, and I'm not licensed to practice medicine in every state. So you usually can't just look at labs because it's a lot more of the story. There's a history. There's when have they taken? When was this? When was that? That kind of thing. So been on thyroid medicine for the last 5 years, but I'm always so tired. Reposting PAL. All right. If you're tired all day long, I always think it's thyroid. If you're tired in the morning, then you feel better, then you're tired again. That could be your adrenal hormones. And I'm wondering also, reposting PAL, what is your estrogen like? Okay, back on YouTube, can apnea cause your hormones to be off? So we do know that apnea can affect testosterone. Yes, it can suppress testosterone in men especially, but also for women. So that is definitely something that can be associated with hormone issues. Okay, just a small town girl living in a lonely world. Should I get my hormone levels checked and thyroid rechecked after losing 110 pounds? Yes, absolutely. Congratulations. I hope that's something that you wanted to do and you weren't sick or something. Lily, I had a hysterectomy at 8:39. 8:39. What does that mean? 8:39. Age 39, maybe age 39. I am now 62 and still experiencing severe night sweats. Wow. When people are that age and still having issues, it's either cortisol or DHEA. Angie Rains, on BHRT, thyroid med, have problems with low cortisol and hair loss. Okay, so wondering, Angie, do you still have ongoing stress in your life? Is there something that you can control, or is it something you can actually identify? Think about yeast. Yeast can also cause hair loss, nutrient deficiencies also, the wrong doses. Are you on testosterone? Are you on DHEA? Those are things that I think about. Lily, I recently added topical estradiol, considering adding topical progesterone as well. Okay, so I usually do progesterone with estrogen no matter what, if you have a uterus or not, but hopefully that will help. Kayla, yes, I know, but listen, I feel sorry for women too, but because of this app and because of Instagram and because of YouTube, there's so many more things that are available to women. As I mentioned, I've been doing this for 23 years. And now this is a time when you guys can get this kind of information. I don't even know. I guess I had a cell phone 23 years ago, but we certainly didn't have this kind of discussion. Sunrise, sorry if discussed again. What's your thought on pellet for testosterone? What goal level? So I feel like pellets work pretty well for men because they have higher levels of testosterone and a little more stable. But for women, there's a lot of things that can go on. So normally what I've seen, the goal for testosterone pellets are like 3 times normal. It really depends on the patient. I know they're saying 100, 150. I don't practice that way, so I can't really say that. Okay, Faith, I'm on testosterone cream and my total testosterone is high, but free is low. Do you know why? Usually it's estradiol. Estradiol is high. It increases your sex hormone binding globulin. Reposting, pal. Last time you checked, it was high. It was okay. You're talking about your thyroid. Yeah, I wonder if they do the whole thyroid panel, TSH, free T3, free T4. Is there a hormone replacement pill that doesn't cause blood clots? We don't, pills will increase the risk of blood clots, yes. All oral medication, oral estrogen, and oral progestins. If it is cortisol, what should I do about it? Well, that's a really complicated, long question, but I've done a lot of videos on cortisol, so check them out here on YouTube. Sunrise, pellet level 307. I feel like menopause symptoms are back. See, that's the thing about testosterone. At really high levels, you're going to start having symptoms. Does the history of PCOS treatment of perimenopause more complex? It can, Stacey, but sometimes people actually feel better. Nicole, thanks for joining on YouTube. I haven't seen a specialist in some years. I honestly don't know where to start. I'm approaching my 40s. I've never been pregnant and can had a consistent cycle. Anyone recommendations are appreciated. Okay, so ways to find a provider, Nicole. Oh, go to the number 4M, a4m.org. Is it org? a4m.org, I think. If org doesn't get you there, do com. In the right-hand corner, it says provider directory. Check your zip code and put in hormone specialist. And that would be my way for you, best way to get someone trained in what you need. So Leroy's mom says, are you taking patients? So I just cut back in my office, so I'm cutting back on new patients, but I can only see patients in the state of Ohio. So every state is different. And in Ohio, we have to follow their rules. I don't make the rules, but we have to see patients face-to-face first. And then for a year, we can do virtual. But that first visit has to be face-to-face. So for those of you in Ohio, we're in Akron, Ohio. And then it can be telemedicine. Thank you guys for joining me. I wanted to let you know about a few new things that we have that are free. We have a free download on natural therapies for mood issues. We have a free download on testing for perimenopause. We have a free hormone course. Those are all in, the link is in the bio. Is the advocacy checklist up there yet on the website?
Not yet.
Okay, so check out my website,
Brad,
drtarascott.com. They're all there. If you can't get the link in my link tree here, check out drtarascott.com. If you guys aren't following me, give me a follow and tune in Tuesdays on YouTube. You can also see all the links there. It's easier to search on YouTube, and on Instagram, I'm Hormone Guru MD, trying to manage the content there. Sign up for our free newsletter. It comes out every Tuesday. Lots of content coming out there. Would love for you guys to give me some feedback on the newsletter. Wendy Means, do you prescribe progesterone troche a lot? Yes, I love the troches. We use it for progesterone, testosterone, DHEA. Not really estrogen that much, but definitely for progesterone. It really depends on the people. But thank you guys for joining. And I'm sorry if I didn't get to all the questions. Check me out on Tuesdays and also check out all my content here and on YouTube. And I hope you guys are having a great day. It looks like it's storming outside, and I think my Wi-Fi might go out, so I better just take off now. So thanks, and hope you guys are all well. You just said I have a